We don't have interruption, I hope. And continuing with the beta blockers, so we were on the propranolol being the prototype drug for beta blockers. We did about the pharmacological actions when propranolol is given in the body. So what are the pharmacological actions exerted in the body? So continuing with the propranolol, we are towards the adverse drug reactions, and we'll also do about the therapeutic indications or uses of propranolol. So coming to the adverse drug reactions of propranolol. So there's a precipitation of the congestive cardiac failure. So there is bradycardia, respiratory system dysfunction like precipitation of asthma and COPD, variant angina exacerbation, tiredness and reduced exercise capacity, colds, hands and feet, prolonging the hypoglycemic episodes. So others like GIT upset, nightmare, forgetfulness, and sexual distress, and the gradual withdrawal after chronic use of propranolol or beta blockers should be done. So coming to the each of these adverse drug reactions of propranolol, so most of the adverse drug reactions and uses of these beta blockers or as well as the alpha blockers, so most of these things will be discussed in very much in your digital like congestive cardiac failure, similarly angina. So similarly, we do have the myocardial infarction, which will come on the uses of this propranolol. This will be very discussed. This will be discussed in detail in your CVS section in the first year only. But we'll be doing some of the portion of that related to it. So coming to the first point, the precipitation of the congestive cardiac failure. So congestive cardiac failure or your angina or MI or सबै detail मा हुन्छ CVS मा, but अलिअलि चाहिँ नि यहाँ पनि हुन्छ. So congestive cardiac failure. So it is a condition in which the heart is unable to pump the sufficient amount of the blood to meet the metabolic demands of the body. So congestive cardiac failure there occurs the disability in the heart, and the heart is unable to pump the sufficient amount of blood according to the metabolic demands of the body. And they are divided into compensated congestive cardiac failure and decompensated congestive cardiac failure. So heart congestive cardiac failure the heart is unable to pump sufficient amount of body. And what does the body do now as a compensatory mechanism, as a reflex mechanism? So there occurs the increased sympathetic activity. So increase in sympathetic activity means there will be release in excessive release of adrenaline, non-adrenaline or adrenergic neurotransmitters, which will act on different adrenergic receptors, alpha receptors, beta receptors, and will ultimately increase the heart rate, will cause the vasoconstriction, will cause the release of increased release of renin via the stimulation of alpha receptors, by the stimulation of the beta receptors. And now these all will restore the cardiac function. So CHF मा cardiac output or cardiac output घटिराखेको थियो due to inability of the heart to pump sufficient amount of blood. So body goes under compensation, the heart undergoes compensation. As a result, there is increase in sympathetic activity, which results in the increase in heart rate, increase in vasoconstriction, increase in renin release, and this all will restore the cardiac output. So this is the compensated congestive cardiac failure, in which the heart or in which the body is compensated, so via the increase in sympathetic activity. So but when this compensation increases, or when there is increase in sympathetic activity as a compensatory mechanism, as a reflex mechanism, so there will be increase in workload of the heart, because heart is undergoing the increase in heart rate. So there is tachycardia, there is vasoconstriction, there is increase in renin release. So there is increase in workload in the heart. An increase in workload in the heart will further deteriorate the condition of the heart, further deteriorate the condition of the heart performance. And now the condition goes towards the decompensated congestive cardiac failure. Compensated congestive cardiac failure means increase in sympathetic activity ले चाहिने heart को performance restore गरिराखेको थियो. But on long term, what does it go? So it goes towards the increase in workload to the heart, increase in deterioration of the performance of the heart. So, and now the condition goes towards the decompensated congestive cardiac failure. So there are two conditions, compensated and decompensated. So beta blockers can be used in one of the congestive cardiac failure, and one of the adverse effect of beta blockers is precipitation of one form of the congestive cardiac failure. So here, so beta blockers precipitate, or the propranolol precipitate the compensated congestive cardiac failure, and hence they are contraindicated in compensated congestive cardiac failure. because in compensated congestive cardiac failure, body is trying to restore the normal function by increasing the sympathetic activity, by increasing the heart rate, by increasing the vasoconstriction. But when you give beta blockers, so what happens? So the beta blockers decreases the sympathetic activities. They will block the sympathetic activity, and increase in sympathetic activity, which was done to restore the congestive cardiac failure, which was done to compensate the congestive cardiac failure, will be now exaggerated because you are decreasing this increased sympathetic activity with the use of beta blockers. So they are contraindicated in the patients who are suffering from the compensated congestive cardiac failure. So use Chinese answer decompensated congestive cardiac failure. We'll come towards this on the use section of propranolol. So congestive cardiac failure is precipitated with the use of propranolol. That is when you are using propranolol in the treatment of compensated congestive cardiac failure. And it causes the bradycardia because propranolol is non-selective beta blockers. It will block both beta 1 as well as beta 2 receptors. So blockade of beta 2 receptors will cause the decrease in heart rate and will cause the bradycardia, and hence they are also contraindicated in the patients who are suffering from the bradycardia. Similarly, since it is a non-selective beta blockers, so it will block both beta 1 and beta 2 receptors. So blockade of beta 2 receptors will constrict the bronchioles present in the lungs and will further constrict the bronchioles, which was already done in the asthma and COPD. So asthma or COPD already there is bronchoconstriction by tachycardia. So when you are giving beta blockers, it will block the beta 2 receptors that are present in the bronchioles. So it will further constrict those bronchioles, and patient will have difficulty in breathing much more, and hence they are contraindicated in patients who are suffering from the asthma and COPD. So if the person is suffering from the hypertension and he or she is also suffering from the asthma or COPD, so we do have different antihypertensive group of drugs. So यसमा चाहिँ बीटा ब्लकर्स नदिने अरू एन्टिहाइपरटेन्सिभ ड्रग्सहरू दिने यदि बीटा ब्लकर्स नै दिनु पर्यो भने कुन चाहिँ प्रिफर गर्ने you should be the patient should be given cardio-selective beta blockers or the selective beta 1 blockers, which won't have any effect on the beta 2 receptors. So, and the next contraindication or next adverse drug reaction of propranolol includes the exacerbation of the variant angina. So, अघि भने जस्तै यो CHF यो angina or CVS मा एकदमै डिटेलमा हुन्छ है छुट्टा छुट्टै च्याप्टरहरुमा. So for now, so we are going very in short. So angina is the condition. It also affects the heart, and in angina there occurs the severe chest pain, and severe chest pain occurs as a result of decreased coronary blood flow. So coronary artery supplies the heart. So coronary artery supplies the heart, and it provides the blood and oxygen to the heart. And angina occurs when there is decreased coronary flow, and as a result, clinical manifestation there is the severe chest pain. And there are different variants of these angina, different classes of angina, different types of angina: stable angina, unstable angina, and transmetal angina, which are also known as variant angina. So angina, so suppose this is the coronary artery, and angina ke bhairaheko huncha. Usually there is a formation of atheromatous plaque in the coronary artery. So atheromatous plaque is the collection of the lipids, is the collection of the fats, the collection of the calcium, etc. in the coronary artery. So there is a formation of atheromatous plaque in the coronary artery, and due to this formation of the atheromatous plaque, so blood cannot flow properly towards the coronary arteries, and there will be decreased blood supply, there will be decreased oxygen supply to the heart. Okay, so coming to different variants of this angina, so stable angina is there, which is most common form of the angina, and it occurs as a result of increase in demand, like in exercise or emotion. So stable angina usually occurs during the increased demand, like when the person is performing exercise or when he or she is in stress or emotion. So stable angina occurs, and in unstable angina, it is unpredictable and it can occur at rest. Unlike stable angina, which occurs more commonly while performing exercise, while person is emotion or in stress. So, and the pathogenesis lies here. So there is also the atheromatous plaque similar to that of the stable angina. So stable angina ma yo plaques and stable huncha, but in unstable angina there is always chance of the rupture of this atheromatous plaque, and there occurs the formation of the blood clot. So when there is rupture of the atheromatous plaque, when there is formation of the blood clot in the coronary artery, so के हुन्छ त जुन अक्सिजनहरु जुन ब्लड हार्टमा जानुपर्ने हो त्यो चाहिँ एकदमै कम हुन्छ ओके so stable angina the atheromatous plaque is stable whereas unstable angina it's unstable and can lead to breakage and it can lead to rupture and formation of blood clot anytime and it can occur at rest so and it is unstable angina is the most dangerous most severe form of the angina and coming to another form of the angina this is the prismatal angina, which is also known as the variant angina. And prismatal or the variant angina, usually there occurs the vasospasm of the coronary arteries, or there is a constriction of this coronary arteries. And atheromatous plaque can be present or cannot be present. So more commonly, variant angina or prismatal angina, there is the vasospasm. So vasospasm also, but this atheromatous plaque can be or cannot be present. It can be with or without the atheromatous plaque. And similar to unstable angina, the onset is sudden and there is no clear triggers like exercise and emotion in case of stable angina. So there are different variants of angina. So we were on the adverse drug reaction of the propranolol or non-selective beta blockers or the prototype drug of beta blockers. So it causes the exacerbation, it causes the precipitation of the variant angina. Why? Because in variant angina, there is already the vasospasm. So due to this vasospasm, the blood is not flowing properly towards the coronary arteries and hence the heart becomes deprived of oxygen and blood supply, enough blood supply and oxygen supply. So when you are giving propranolol, so it blocks both beta-1 as well as beta-2 receptors. So blockade of beta-2 receptors ले के हुन्छ त भन्दाखेरि vasoconstriction हुन्छ हैन The blockade of beta-2 receptor causes vasoconstriction. So since already there is the vasoconstriction, there is already the vasospasm. So it should not be given in variant angina because so it will further exacerbate those vasospasm by the blockade of beta-2 receptors that are present in the heart. Okay. So the vasospasm also precipitate huncha. So it cannot be given or adverse reaction of propranolol is variant angina exacerbation. And when the person is performing exercise, a patient will feel more tired and there will be reduced exercise capacity. So you know this beta blockers, so they block the beta-2 receptors, beta-1 receptors. So this action, tiredness and reduced exercise capacity is more linked towards the blockade of the beta-2 receptors. So blockade of beta-2 receptors ले के हुन्छ त भन्दाखेरि चाहिँ हैन एक्सरसाइजको बेलामा अझ बडी ब्लडहरु चाहिराखेको हुन्छ स्पेशली द स्केलेटल मसल्स or the larger blood vessels like so by the blockade of beta-2 receptors what you are doing you are vasoconstricting those large blood vessels so के हुन्छ त reduced exercise जति blood जानु पर्ने हो त्यो चाहिँ नि अझ कम भएर आउँछ so there will be reduced exercise capacity moreover so blockade due to blockade of this beta-2 receptors so glycogenolysis or normally stimulation of beta-2 receptor ले भइराखेको हुन्थ्यो अब beta-2 receptors block भएपछि के हुन्छ glycogenolysis हरु inhibit हुन्छ so glycogenolysis is the breakdown of glycogen to glucose so when there is blockade of this glycogenolysis or the inhibition of glycogenolysis so glucose को amount के हुन्छ blood glucose amount को that will be less due to inhibition of glycogenolysis and decrease in blood glucose level will lead to the tiredness and reduced exercise capacity because exercise को लागि अझ बढी glucose हरु चाहिराखेको हुन्छ so when you are inhibiting glycogenolysis and when you are causing the vasoconstriction of those larger arteries so there will be reduced exercise capacity as well as the tiredness in those particular patients who are taking the propranolol. Similarly, it will cause the cold hands and feet and it causes the worsening of the peripheral vascular disease. The peripheral vascular disease हामीले alpha blockers प्राजसमा पनि डिस्कस गरेको थियौं. The peripheral vascular disease is also known as Raynaud's phenomenon or Raynaud's disease and usually in that case there occurs the vasoconstriction, vasospasm of the arteries that supplies the extremities as for example toes or fingers. So there occurs a vasoconstriction. So and this can lead to the discoloration of the toes. This can lead to discoloration of the fingers, whitish to bluish discoloration due to decrease in blood supply, due to decrease in oxygen supply, due to vasospasm or vasoconstriction. So when you are giving propranolol, so due to blockade of beta-2 receptors, it will exaggerate those vasoconstriction because beta 2 blockers दिँदाखेरि जुन vasodilatation normally हुनुपर्ने थियो beta 2 receptor stimulate भएर अब के हुन्छ त्यो block हुन्छ. So you are exaggerating the condition. And coming towards the another adverse effect, it will when given to the patients who are suffering from the diabetes mellitus, so and who are taking insulin, so diabetes mellitus treatment ko लागि usually patient hरुले insulin लिइराखेको हुन्छ. So in that patient who are taking insulin for the diabetes mellitus, it will prolong the hypoglycemic episode. So how does it prolong hypoglycemic episode? So insulin is the most common therapy, most frequent therapy that's given for the treatment of the diabetes mellitus or the patients who are suffering from the high blood glucose level. So for that, insulin is given, and as a therapy, so insulin ko most common adverse effect भनेको चाहिँ के हो त, it causes hypoglycemia. So insulin causes hypoglycemia as most common adverse effect. So hypoglycemia, when the patient goes towards the hypoglycemia, what are the clinical manifestations? The clinical manifestations include the increase in sympathetic activity, like increase in anxiety, there is increase in sweating, there is increase in palpitations, increased tremors, okay? So person is very likely to go under hypoglycemic episodes who are taking insulin as an adverse effect, and the adverse effect of this hypoglycemia is usually manifested as increase in sympathetic activity like increase in sweating, anxiety, palpitation, and tremors. So a patient is suffering from the diabetes mellitus. Suppose a patient is suffering from both the diabetes mellitus, he is taking insulin, and the same person is suffering from the hypertension, and he or she is taking beta blockers. So you know the beta blockers, as for example propranolol. So propranolol also by blockade of both the beta 1 as well as the beta 2 receptors, especially the beta 1 receptors. By blockade of beta 1 receptors, what does they do? They will decrease the anxiety, they will decrease the anxiety, they will decrease the sweating, they will decrease tremors, they will decrease the palpitation, because beta blockers is related to blockade of all the sympathetic activity. So beta blockers will block all the sympathetic activity as a result of hypoglycemic episodes that the person was undergoing. So it will marks the symptoms that has appeared as a hypoglycemic episodes. So यसले गर्दा के हुन्छ, now there will be the prolongation of the hypoglycemia. So anxiety, sweating, tremors, palpitation जुन चाहिँ hypoglycemia ले गरिराखेको थियो due to adverse effect of insulin. So के हुन्छ त भन्दाखेरि चाहिँ when you are giving beta blockers in that patient, so it will prolong, it will decrease all these actions, it will decrease the anxiety, it will decrease all the sympathetic activity, it will decrease sweating, so it will decrease palpitation and tremors. And now there is no action of anxiety, there is no action of increased sweating, there is no action of tremors and palpitation, and due to this reason it will prolong the hypoglycemic episodes. So others adverse drug reaction include GIT upset, nightmare, forgetfulness, and sexual distress. And when you are giving beta blockers, as for example propranolol, for the long period of time, there should be always gradual withdrawal after chronic use. There should be no sudden withdrawal, there should be no abrupt withdrawal. So the withdrawal of propranolol after the long administration of that propranolol should be gradual. Because as for example you are giving this propranolol for the treatment of hypertension, and you suddenly or abruptly withdraw the propranolol after the chronic use, after the long-term administration, there occurs the rebound hypertension. So there is always the high chance of causing rebound hypertension. So it occurs, so rebound hypertension occurs as a result of chronic therapy with beta blockers, and when you suddenly withdraw that particular beta blockers. So as for example, so when you are giving beta blockers, so the receptors have been blocked for a very long time by the use of the propranolol. So propranolol is going to block those alpha receptors, propranolol is going to block those beta 1 receptors, beta 2 receptors very long time. And the receptors that were blocked initially by beta blockers, and when you do the sudden withdrawal of that beta blockers, will be hyper responsive to catecholamines. पहिला चाहिँ beta blockers bind गरिराखेको थियो beta 1 beta 2 receptors मा. When they are suddenly withdrawal सो के हुन्छ त भन्दाखेरि अब चाहिँ नि नर्मली जुन न्युरोट्रान्समिटर एड्रिनालिन नन एड्रिनालिन रिलिज भइराखेको थियो अब बिटा ब्लकर्स जहाँ बाइन्ड भएको थियो अल्फा रिसेप्टर्समा सरी बिटा रिसेप्टर्समा त्यहाँ गएर अब के बाइन्ड हुन्छ त अब त्यहाँ गएर चाहिँ नि adrenaline, non-adrenaline or adrenergic neurotransmitter गएर bind हुन्छ and these are very this beta receptors which were blocked for so long time they are hyper responsive to this adrenaline non-adrenaline and as a result अब के हुन्छ त rebound hypertension चाहिँ नै हुन सक्छ so now this adrenaline non-adrenaline will bind to alpha receptors will bind to beta receptors and will cause the rebound hypertension. So the withdrawal of this beta blockers should be always be gradual, not the sudden or the abrupt withdrawal. So these are the adverse drug reactions related to the use of propranolol, and these are the contraindications of propranolol as well. So your condition or propranolol should not be given. Now coming towards the uses of beta blockers or the propranolol, the most common use of these beta blockers or propranolol is in the treatment of hypertension. And as discussed in last class, the use of beta blockers in hypertension should be of long term. So 15 दिन use गर्यो 1 महिना use गर्यो so it does not cause a decrease in blood pressure. So it should be long term administration for the use of beta blockers to work in the hypertension. And hypertension मा कसरी काम गर्छ so it is usually due to the decrease in cardiac output. So cardiac output decrease हुँदाखेरि पछि गएर चाहिँ resistance vesselsहरू or the peripheral arteriesहरू they become adapted towards the decrease in cardiac output and now the blood pressure decreases. So the use of beta blockers in the hypertension we have discussed in yesterday's class. So now coming to another use of beta blockers. So they are used in the treatment of the angina pectoris and they are used for the treatment of the stable angina and the classical angina. So हामीले यो angina 3 types को पढेको थियौं एउटा चाहिँ stable angina अर्को चाहिँ unstable angina अर्को चाहिँ prinzmetal or the variant angina. So adverse effect or contraindication भनेको चाहिँ prinzmetal angina हो. So please don't get confused. It should not be used in patients who are suffering from the variant angina because variant angina मा already vasospasm भइराखेको हुन्छ. So when you are giving beta blockers, you are further exaggerating the vasospasm by blocking the vessels, blood vessels of the coronary arteries by causing the vasoconstriction. So it's contraindication. But the use of this beta blockers is in the treatment of the stable angina. So you know this angina is the condition of the chest pain and classical angina or the stable angina. Classical angina or the stable angina is the condition which is one form of the angina which occurs as a result of increased demand like discussed earlier as for example in exercise, in emotion or the stress condition. So classical angina ma usually के भइराखेको हुन्छ भने there is increased in demand. So there this increase in demand of blood, this increase in demand of oxygen is during the exercise, during the stress, during the emotional condition. And what do beta blockers or the propranolol do is in the stable or the classical angina, they decreases the heart rate, they decreases the blood pressure by causing the increase in cardiac output, they decreases the force of contraction. So as a whole, so since it decreases the heart rate, it decreases the blood pressure, it decreases the force of contraction, it decreases the total workload of the heart. That means the classical angina increased demand ले भइराखेको थियो. So when we give beta blockers, so by increasing the heart rate, by decreasing the heart rate, by decreasing the force of contraction, so you are decreasing the workload of the heart or you are decreasing the demand of the heart. And when the heart does not have to work hard by decreasing the workload, so it requires less amount of the oxygen, it requires less amount of the blood. So it helps in relieving the chest pain that occurs with the that occurs in the stable or the classical angina. So normally the beta blockers or the propranolol they decreases the demand. So in a classical angina, stable angina, there is increase in the demand of the oxygen. And when you are giving beta blockers, you are decreasing the demand by decreasing the cardiac output, by decreasing the heart rate, by decreasing the force of contraction. That means now the heart have to do less amount of work. So when the heart has to do less amount of the work, so it requires less oxygen And now this will help in relieving the chest pain that occurs with the stable angina, that occurs with the classical angina. And the next use of the beta blockers is in the treatment of myocardial infarction. So myocardial infarction is a severe form of the angina pectoris. So myocardial infarction myoclonus. So you can see here by the name. So myocardial infarction. So there occurs the infarction of the cardiac muscles. There occurs the infarction of the myocytes or myocardial cells. So why does it occur? So it is a life-threatening condition and it should be treated as early as possible. So लेमेन टर्ममा भन्दाखेरि चाहिँ myocardial infarction लाई चाहिँ heart attack भनेर भन्छ है. So it is a very life-threatening condition and it should be treated as early as possible because the chance of survival after the MI is very less. And it occurs when the blood flow to the heart muscle is abruptly cut off and causing the tissue or the myocytes to damage. So अघि चाहिँ नि एन्जाइना पेक्टोरिसमा के भएको थियो, एथ्रोमेटस प्लाग भइराखेको थियो. एथ्रोमेटस प्लागको रिजनले गर्दा चाहिँ नि जति ब्लड जानुपर्ने हो त्यति गएको छैन. So the heart becomes deprived of sufficient amount of the oxygen, sufficient amount of the blood. So whereas the myocardial infarction, which is a severe form of this angina, so यसमा चाहिँ नि के हुन्छ भन्दाखेरि चाहिँ नि the coronary flow, the blood flow towards the heart is now suddenly cut off. एमा चाहिँ नि एन्जाइनामा अलिअलि भए पनि blood flow हुन्छ, but myocardial infarction मा चाहिँ नि suddenly the blood flow towards the heart, towards the myocardium is suddenly or acutely cut off. And yes, the pathophysiology is similar, so it occurs as a result of the deposition of the atheromatous plaque. अनि अर्को जुन stable unstable angina थियो, यो चाहिँ नि unstable angina has very high tendency to go towards the myocardial infarction है. So we were on the myocardial infarction, and similar to angina pectoris, there occurs the severe chest pain. So severe this myocardial infarction is a severe form of the angina pectoris, and due to sudden deprivation of the oxygen supply to the heart in case of myocardial infarction, the infarction of the cardiac cells occur, the cell death of the myocytes occur, and we are using beta blockers in the treatment of myocardial infarction. So how does beta blockers act or help in the myocardial infarction? So beta blockers, it decreases the workload of the heart. So it decreases the workload of the heart by decreasing the heart rate, by decreasing the force of contraction, by decreasing the cardiac output. That means you are reducing the oxygen consumption by the heart cells. So the tissues which were partially ischemic due to myocardial infarction can survive because you are reducing the workload of the heart. So reducing the workload of the heart means decreasing the oxygen consumption by the myocytes. And tissue which were partially ischemic due to myocardial infarction, they can survive. And as a compensatory mechanism in myocardial infarction, so heart can undergo arrhythmia. So beta blockers will prevent that arrhythmia as well by the blockade of the beta 1 receptors. And when these beta blockers are used for long time in the treatment of this myocardial infarction, so it can reduce the subsequent mortality in those particular patients by preventing the reinfarction and by preventing the arrhythmias in future as well. So this beta blockers should be used in myocardial infarction. So myocardial infarction, which is a severe form of the angina, here also occurs this severe chest pain and occurs as a result of abrupt or sudden cut off of this blood flow towards the coronary arteries, and as a result the heart muscles is unable to get the enough of the blood, enough of the oxygen, and now there undergoes ischemia. So ischemia can lead to the infarction of those myocytes. And the beta blockers, what does they do? They decreases the workload of the heart. So decreasing the workload of the heart means decrease in oxygen consumption by the heart cells, and the tissues which were partially ischemic who can survive. And as a compensatory mechanism, so in myocardial infarction, so increase in sympathetic activity can be there by the heart, and it prevents those sympathetic activity as well. Beta blockers prevent sympathetic activity as well. And when these beta blockers are used for long time after the recovery from the myocardial infarction, the long-term use of beta blockers can prevent in the future, prevent the reinfarction and also prevent the arrhythmia. and they are used in the treatment of congestive cardiac failure. So if you see here, so one of the adverse effects of this propranolol is in the it causes the precipitation of the compensated congestive cardiac failure. But the use of this congestive cardiac failure, the use of propranolol is also in the congestive cardiac failure, but another type, so they can be used in the treatment of the decompensated congestive cardiac failure. So we have already seen this picture. So this compensated congestive cardiac failure, in which there was increase in sympathetic activity as a result of compensation as a result of reflex mechanism by the body in congestive cardiac failure. So there is increase in sympathetic activity, but this increase in sympathetic activity, that's increase in heart rate, increase in vasoconstriction, on long term can lead to the increase in workload in the heart, and this can deteriorate the heart performance. So when you give these beta blockers or propranolol in decompensated congestive cardiac failure, so usually these beta blockers in decompensated congestive cardiac failure should be introduced from low dose, and it should be administered for long period of time. So how does this condition is benefited by the use of propranolol or non-selective beta blockers? Because it causes the antagonism of the increase in sympathetic activity, because increase in sympathetic activity is still going on the decompensated congestive cardiac failure, and this has led to the decrease in heart performance. So when you give beta blockers, it will antagonize, it will block those sympathetic overactivity, and this sympathetic overactivity has bad effect on the heart. It can result in the myocyte apoptosis, and cause the remodeling or the unusual remodeling or change in the shape of the heart. So in the decompensated congestive cardiac failure, when you are giving propranolol or when you are giving this beta blockers, so they decreases the sympathetic activity. The decrease in sympathetic activity means decrease in deterioration of the heart performance, and they can be used, and they will benefit this decompensated congestive cardiac failure. Uh, Give me some time, okay? Okay, so we were on the uses of beta blockers, and so they are used in the treatment of hypertension. They are used in the classical or the stable form of the angina. They are used in myocardial infarction. They are used in the treatment of decompensated congestive cardiac failure, and obviously they are used in the treatment of the cardiac arrhythmia. So arrhythmia, भनेको चाहिँ नि, it can be tachyarrhythmia or it can be bradyarrhythmia. So tachyarrhythmia there is increase in heart rate, and bradyarrhythmia there is decrease in heart rate. So but arrhythmia चाहिँ नि हामीले usually चाहिँ नि increase in heart rate or tachycardia or tachyarrhythmia लाई भन्छ. So this beta blockers, propranolol, they block the beta 1 receptors and decreases the heart rate, so they can be used in the treatment. So they are used in the treatment of the cardiac arrhythmia, especially the tachycardia or tachyarrhythmias. And coming to the next use of this beta blockers or the propranolol, they are used for the treatment of the thyrotoxicosis. So thyrotoxicosis is the severe hyperthyroidism. So severe hyperthyroidism. So hyperthyroidism, thyroid level of thyroid hormones is increased. T3 and T4 hormones are increased. So thyrotoxicosis, it is a severe form of hyperthyroidism in which there is very much high level of T3 and T4 secretion in the body. And the thyrotoxicosis, usually there is increase in sympathetic activity like increase in sweating, increase in anxiety, increase in tremors, increase in palpitation, increase in heart rate. So thyrotoxicosis जुन increase in sympathetic activity भइराखेको हुन्छ. So beta blockers, they all decreases those increase in sympathetic activity by blockade of beta 1, especially by blockade of beta 1 receptors. and they are also used in the migraine. So migraine, there are two types of migraine: acute migraine and the chronic migraine. So acute migraine, chronic migraine. So acute migraine ma pain चाहिँ नि usually patient लाई भइराखेको हुन्छ. Chronic migraine मा चाहिँ नि it is the period between the two pain periods. So acute migraine मा चाहिँ नि usually NSAIDs हरू use भइराखेको हुन्छ, and there are specific drugs for the treatment of migraine in acute migraine. अनि chronic migraine मा usually beta blockers or propranolol use भइराखेको हुन्छ. But how does it work in migraine? So the pathophysiology has not been well understood. So, but it is used in the treatment of the chronic migraine, and obviously they are used in the treatment of the anxiety by because they block the beta 1 receptors, and anxiety palpitation is usually related to the stimulation of beta 1 receptors. So they are used in the treatment of the anxiety, and they are used in the treatment of the essential tremors. So essential tremors is a neurological condition, and it causes the involuntary shaking of the different body parts. Especially it causes the involuntary shaking of the hands, and how the cause is unknown, and maybe maybe there is the disorientation of the cerebellum, or cerebellum and other parts of the brain. They are not communicating properly. So cerebellum and other parts of the brain are not communicating properly, but correct mechanism is not known why these essential tremors occur. So it causes the treatment. It is used in the treatment of the essential tremors, because tremors is usually related to the stimulation of the beta 2 receptors that are present on the skeletal muscle. So it blocks it, and hence they can be used in the treatment of the essential tremors. And similarly, they are used in the treatment of the glaucoma, and glaucoma it causes the decrease in aqueous humor formation. It decreases the aqueous humor production, so by blocking the beta 2 receptors in the ciliary epithelium. So ciliary epithelium usually beta 2 receptors are भइराखेको हुन्छ, so which causes the formation, which causes the release secretion of this aqueous humor. So they block those beta 2 receptors in ciliary epithelium, and hence decreases the aqueous humor formation. So these are the uses of beta blockers. Now coming to